I didn't know. Okay, मलाई थाहा थिएन that there is a difference between heart attack, stroke, cardiac arrest. There's difference between
Yeah.
all of these things, right? Recently, when I was just studying about a few things, I was like, oh my God, these are all completely different things, right? Would you mind elaborating a little bit about what people go through when it comes to heart problems?
So, just for general information and knowledge, so what I would say is heart disease, there's a big spectrum of this disease. Do I need to speak in English or Nepali? Any?
जे बोले पनि हुन्छ. Bilingual would be best.
Okay. त्यसै कारण हामीहरू चाहिँ congenital भन्छौँ कि जन्मजात रोग. Congenital. So जन्मजात रोग. So when you are born, you have some form of heart disease. So that is actually 1 in 100 live births. So out of 100 people who are born, one will have some form of, it could be a minor, it could be major. And that itself is a big...
What? Are you hearing this? Okay, 1 in 100 will have
live
something
births.
or the other.
Yeah, so it can be just like small hole in the heart to, like major valve problem or basically heart ko banawat my variation. And most of this is treated surgically, okay? So that's where we come in.
Yeah, obviously.
And now they are specified congenital surgeons, so congenital heart surgeons, so it's a subspecialty. So that is one. You have a lot of those patients, one. Then the second is what we say is valve, mutuko valve bhaन्छौँ नि. Valve को समस्या भएको हो, valvular heart disease हरु. अब त्यो चाहिँ नेपालमा कस्तो छ भने rheumatic बातजोर भन्छ नि. So that prevalence is very high. So the Western countries, more developed countries, that incidence is going down. South Asia, that is still the predominant valvular heart disease. बातजोर भनेको चाहिँ त्यो घाँटीमा संक्रमण हुन्छ when you are a school kid, not treated properly. Then the body's reaction causes antibodies to form that affects the heart.
Okay.
And that can affect the valves.
So घाँटीमा चाहिँ के problem हुने? Thyroid?
होइन, infection.
Okay. So बच्चामा हुँदा tonsil
yeah.
infection, this infection, that infection.
Yeah, so that's what part. So whenever you have a throat infection, then you need to go see a physician because it can have implication. Not minor ones. There's a specific, it does, we shouldn't get everyone crazy about it, but it's a specific form of infection. But if it is persisting, then you need to, get it checked. So that prevalence is almost 1, in some, it's up to even 10, 1 to 2, we would say, per 1,000.
Okay.
School kids, 5 to 15.
Okay.
So that's the second group. And then that same valve disease you can have as you grow old. It's we call it degenerative. त्यो खिँदै जाने. जस्तै मुटुको valve पनि खिँदै जान्छ.
बुढो हुँदै गइसकेपछि.
So sometimes you need to do a surgical procedure to either replace it. So you replace it with, either you can repair it, मर्मत गर्नु पर्यो, कि replace गर्नु पर्यो. Okay. So I won't go in details with that. Then is the one that we talked a little about is the coronary artery disease. So it's when your hridayaghat, mutuko, which is very more commonly talked because it happens in the middle age group, हैन. त्यसमा चाहिँ it's basically अघिको तीनटा जुन कुरा भने मैले genetical, age, gender, and त्यसपछि all this high blood pressure, diabetes, all these risk factors, cholesterol, lifestyle, air pollution, all these things. So these come in.
Yeah.
Then you come to the fourth one would be is aortic disease. So we are like plumbers.
Yeah.
So the plumbing system of your heart and blood vessels gets affected. It can get swollen, sometimes can tear. So you need to do that. So those are aortic diseases.
Yeah.
Okay. Then there is something that covers the heart. It's a membrane. You can have disease of that. Okay. And then you can even have, believe me or not, you can have tumors of the heart also.
There's a tumor within the heart.
Yes, of the heart, different parts of the heart.
Small little tumors.
Yeah, so just putting it broadly across, it's a big spectrum. So what most of us, there is awareness, but we emphasize more on the hridayaghat part.
Heart attack.
Yeah.
Heart attack English
yeah.
heart
exactly.
attack part. Obvious छ नि त्यो सुन्छौँ पनि हैन हामीले we see it on cinema, we see it on so many different things. हामीले त्यो सुन्दा बानी भइसक्यो okay. नेपालमा कुन surgery चाहिँ do you have to do the most?
So
what is our major problem?
So right now, if you look at the recent statistics of the whole country, we've worked on it, and we've 2019 we got all the data of the entire country. So the most surgeries we do is valve in Nepal as heart surgeons.
Yeah.
So that's the most. Then after that is congenital. And then is this coronary. So the coronary numbers are growing up because again coronary हामीहरु जुन त्यो angioplasty spring हाल्दिन्छ stent हाल्छ
Stent हाल्छ, हो.
So that त्यो चाहिँ cardiologist चाहिँ गर्नुहुन्छ. So when it becomes more severe or there's a critical area blockage, then only it comes to us. So that disease is divided between cardiologists and us. So that is also going up. That's why I mentioned, the burden of this disease is climbing up, especially in South Asia.
Oh,
But it's not all
the end of the world.
It's not doom or gloom.
Oh.
It just all it asks is just be aware of it.
Yeah.
This program is brought to you by Vyas Studios.
Thank you very much for supporting the podcast so far. And if you want to see more content, more shows, then make sure that you subscribe to our channel.